inner lining of our blood vessels, our lymph vessels and the heart is a thin layer of cells called endothelium. And if you lay them out flat, 1 cell thick, what's in your body would cover 2 tennis courts. Now normally endothelium is very smooth, but when fats build up in the bloodstream, it becomes sticky. And so do the white blood cells and the platelets, and they all begin to stick to each other, and pretty soon those cells invade through the endothelium and begin to form plaque. Now, endothelial cells don't just sit there looking sleek and watertight. They're actually metabolic and biochemical factories. They're powerhouses that make a substance called nitric oxide. Now, nitric oxide is absolutely essential for healthy blood vessels and for a healthy heart. And what it does is it relaxes the blood vessels, and it can actually choose which ones to relax depending on what's needed right then and there. It also prevents those white blood cells and platelets from getting sticky and starting to build up plaque. It keeps the muscles and the walls of the artery from growing into plaques, and it may even help to diminish plaques once they're established. So here's what we need for nitric oxide production. Pretend this is my nitric oxide factory. There are blocks everywhere. Each block is an amino acid, and amino acids make up proteins. There are about 20 in all, and different foods have different ratios. Vegetable protein has a different ratio to animal protein. So let's say this is animal protein over here, and the amino acid block that we need for nitric oxide happens to be on our vegetable protein. Now, it would be here a lot more. It would still be on our animal proteins, but a lot more on our vegetable proteins. It's called L-arginine. Now, there's also an enzyme called nitric oxide synthase, and the arginine locks in there and it activates that enzyme, and pretty soon nitric oxide is made. However, there is a competing molecule for this enzyme called nitric oxide synthase, and it's called ADMA for short. I'm not going to give you the long name. If you want to know more, it's in Dr. Caldwell Esselstyn's book, but it's called ADMA. It blocks nitric oxide production, but what's amazing is there is a counteracting molecule called DDHA, and DDHA actually destroys ADMA. So off comes that, and it can no longer lock in, all right? Now, this is where all those cardiovascular risk factors come in. They can actually inactivate DDHA, and those would be things like a high cholesterol, high triglycerides, elevated homocysteine, insulin resistance, hypertension, and smoking tobacco. So normally, physical effort or strong emotions will cause the endothelium to start making nitric oxide. The blood vessels dilate, more blood gets to the heart muscle and the other parts of the body that really need it. A bit like this balloon. There you go, that nitric oxide makes those blood vessels dilate, and those blood vessels are nice and soft and stretchy. But if we don't have sufficient nitric oxide, then those blood vessels are rigid and they can't keep up with the need for more blood, and that's when you get angina or a heart attack. Now let me tell you a story about my friend Anne. She was a cardiac cripple. If I took her shopping, I would have to put her in a wheelchair because she could not walk. Her heart would cause her pain. Now, she got to the point where she had angina just sitting at rest, and so she had to go to the hospital. They said that she couldn't lead until she had no angina at rest. They tried her on all the medications. It wasn't helping. They said she should go home and die. But what did I do? I switched her from an animal-based diet to a vegetable-based diet. And within 1 day, for the first time in 2 weeks, she had no chest pain, and she was allowed to go home. The first thing we did was cleaned out her pantry. We got rid of all the animal protein products, replaced them with healthy vegetable protein, and her angina was gone. Pretty soon she was out walking around the yard. And that's how you can get remarkable change in just a few days. Did the plaque disappear yet? No. That's going to take some time. But her endothelium was already starting to heal, and it would be starting to help break down that plaque and reverse her cardiovascular disease.
At halftime, I was a little bit tired and I went to the sideline, and suddenly I fell to the ground. The whole right side of my body had lost feeling and I couldn't get up. I didn't know what was wrong.
They have a bypass, and then they have stents to keep the bypass open. And then they die of what? Congestive heart failure. Why? Because they've never had the causation of the illness treated. Coronary artery heart disease is nothing more than a benign foodborne illness.